All right, the time is now 9 a.m. Eastern time, and we're going to get started. Just a few housekeeping notes before we actually get started. So thank you all for joining us here today. Closed caption can be enabled in the meeting by selecting the closed caption button at the bottom of your screen. Once you click on it, please select Show Subtitle. During today's session, attendees will be muted, but questions will be able to be submitted via the Q&A function at the bottom of the screen. Simply click Q&A and follow the prompts in order to submit a question. We are going to try to get to as many questions as we can during the latter half of the session. So we encourage attendees to both post questions, and you will also be able to upvote other individual questions if you would like those to be read first. Today's session will be recorded and posted in the coming days to the website. And at this point, I will now pass it over to our primary speakers, Laura and Brad.
Great, thank you, Greg. And good morning, good afternoon, everyone. Thank you for joining us for this webinar. We're very happy to be here with you to talk about harnessing data science for health discovery and innovation in Africa, or DSI Africa. In this webinar, I'll briefly do an overview of the DSI Africa program. I'll also do a review of one of the new funding opportunities for DSI Africa, the DSI Africa Research Education Program. I'll then pass it on to my colleague, Brad Newsom, who will discuss the DSI Africa Partnership for Innovation new funding opportunity. And that will be followed by a Q&A session, in which we'll be joined by our colleague Sita from the Center for Scientific Review to answer any of your questions about these funding opportunities, the review, or associated issues. So we can get started. I'm Laura Pavlich. I'm a program officer at the Fogarty International Center. I'm also one of the coordinators for the DSI Africa program, which is supported through the NIH Common Fund. DSI Africa is led, in addition to being led by Common Fund, is also led by 4 other institutes and centers at NIH, including the Fogarty International Center, the National Institute of Biomedical Imaging and Bioengineering, the National Institute of Mental Health, and the National Library of Medicine. The goal of DSI Africa is to spur new health discoveries and catalyze innovation in healthcare, public health, and health research on the continent through the application of data science. Some of the sub-goals that we are using to support this overarching goal are to catalyze new collaborations and explore the state of the field for health data science in Africa, to advance health data science research in Africa and support new African and global partnerships that spur innovation and enhance impact, to increase health data science capacity in Africa, to explore the ethical, legal, and social implications impacting health data science from an African perspective, and to facilitate the development of trans-African network of data scientists and coordinate administrative functions for the network. Additionally, DSI Africa has a number of objectives that are listed in the associated funding opportunities, including consortium participation, partnerships and collaborations, data sharing, community engagement, and data science capacity building. Importantly, for the new funding opportunities, the awardees to these opportunities are expected to participate in the DSI Africa Consortium, which is led by a steering committee and includes associated working groups. The new awardees are also expected to abide by any data sharing policies or guidance that are developed by this consortium. The current DSI Africa Consortium, or group of awardees, includes research hubs that are focused on key health problems, data science research training programs that are developing new master's and PhD level training programs, ethical, legal, and social implications of data science and innovation research projects, and an open data science platform and coordinating center. These awards were launched in September of 2021 as the beginning of the DSI Africa program. And those awards will span over 5 years and include 7 of the research hubs, 7 research training programs, 4 LC research projects, and the Open Data Science Platform and Coordinating Center. These awardees and collaborators span 19 countries across the continent and include funding from 12 institute centers and offices at NIH. You can find the list of awardees on the NIH Common Fund website listed on this slide. The DSI Africa research hubs and research training programs span a vast array of different scientific areas, different health areas, different cross-cutting areas, and different data science areas. These span from climate change to the social determinants of health, cervical cancer to antimicrobial resistance, and really incorporate a large different variety of data science methods and innovation areas, including mobile health, diagnostics, imaging, and more. You can find the list of DSI Africa awardees on the NIH Common Fund website. And this is just a snapshot of that website here. And the address is listed at the top of the page. Each award is listed here, and the award title links out to NIH Reporter. And the NIH Reporter link contains the award abstract, details of the award, and the contact information for each contact PI for the award. So this is a way to find more out about the consortium and potentially reach out to PIs if that is of interest. Other opportunities to meet or learn about the consortium will also be advertised as they develop. And we are expecting there to be a networking event that is advertised soon that will hopefully be held towards the end of July. You can also find out more about the consortium through the DSI Africa Coordinating Center website, which is also listed on this slide. And finally, other applicant resources include recordings from a 2020 DSI Africa symposium that was held. These recordings include breakout clinics on grants management advice, a live demo of the application process through Assist, and advice from prior grant recipients and peer reviewers. Again, those are also found on the NIH Common Fund website. We recommend that new NIH applicants look at the application instructions and guidance on how to apply to NIH on the grants.nih.gov site and how to apply. You can also just Google how to apply to NIH, I think, to pull up this site. And it provides really step-by-step guidance on the various aspects of submitting an NIH application, including the necessary institutional registrations that are required to be able to submit an application. It's quite important to start these registrations early if they're not already in place. Also, make sure to follow the instructions in each funding opportunity announcement and in the SF424 application guide, which is accessible through that website as well. Other resources are the NIH peer review videos and, of course, the recording and slides from this webinar, which will also be posted on the Common Fund website. And finally, the NIH program officers, myself and Brad, and others who work as program officers through the DSI Africa program are always here to try to guide you and answer scientific related questions. Our grants management specialists are available as our application submission support to answer questions related to those areas. So I will move on next then to cover the Research Education Program RFA. So this is RFA RM22-022, or the DSI Africa Research Education Program. It uses a Ue5 activity code, which I'll discuss a little bit later in this slide deck. The goal of the Ue5 is to support creative educational activities with a primary focus on courses for skills development that complement or enhance the training of a workforce to meet the research needs of the DSI Africa program. Some of the requirements of this funding opportunity include that there should be a focus on hands-on immersive experiences. There should be a focus on activities that target educational needs or gaps in the DSI Africa Consortium, which means that applications must have a letter of support from one or more current DSI Africa PDPIs. And finally, activities must involve participants across multiple institutions. Moving on to the programmatic scope of the Ue5, the course topics must focus on building capacity for the DSI African Consortium to spur new health discoveries and catalyze innovation in healthcare, public health, and health research in Africa through the application of data science. You might recognize that as being the goal of the DSI Africa Consortium as a whole. So essentially, the course topics should focus on building capacity related to the goal of DSI Africa. These can be technical, scientific, operational, and/or professional skill building. Again, that is specific to the DSI Africa goal and could be proposed through courses, workshops, or other innovative activities. Complementary activities that develop broad professional skills that are relevant across the entire research enterprise may be incorporated, but these should not be the primary focus of a proposed program. Some of the potential course topics are listed on the slide here and also included in the funding opportunity announcement itself. These are just examples of potential areas that could be proposed by applications, but there certainly are other topics that could also be proposed, and we recommend reaching out to me, the program officer, for this funding opportunity announcement if you have other potential areas that you would like to explore and propose. Some of the potential topics listed here are technical skills using data science approaches and tools, data science skills to organize, manage, and process large biomedical data sets, problem-solving skills like human-centered design as applied to data science innovation, social science and/or data science skills to address the ethical, legal, and social implications and integrate frameworks into health data science projects, team science and/or open science skills for impactful health data science collaborative projects, technology transfer skills for translating data science products or outputs beyond the lab, and finally, community engagement skills to empower communities to become partners in data science research, engage different stakeholders, and facilitate future implementation efforts. Moving on to the course formats and delivery approaches. Formats for these activities may be based on in-person activities, online courses, or a hybrid of both. Certainly encourage the development of creative formats and approaches that extend the reach of the proposed objectives. For example, challenges, hackathons, and innovation labs are considered within scope, and programs can be multifaceted and incorporate multiple types of activities. But again, courses must emphasize hands-on immersive experiences. The course duration can vary, and so it could be one-day workshops to 1 week short courses, summer boot camps, or semester-long immersive experiences. Activities, though, must be completed within a 12-month period and must be offered each year of the award. As for participants, the participants in the program can be at any career stage, but the participant career level should be justified in the application, and the audience should be justified in the application. The outreach and recruitment from outside of the existing consortium is also encouraged as appropriate. This could be, for example, to strengthen the potential trainee recruitment pools for the DSI Africa Research Training Programs, or to enhance the consortium in other ways. And finally, we do require that the applicants consider resource sharing in their application. And so educational resources developed through the program should be findable, accessible, interoperable, and reusable or fair. And awardees will be expected to collaborate with the DSI Africa Open Data Science Platform and Coordinating Center when considering avenues for resource sharing. So just to give a very clear picture of the scope of applications accepted for this RFA, we do also list the types of programs and activities that are considered to be not responsive. This includes programs that do not justify the educational need in the DSI Africa Consortium, programs that are not supported by one or more current DSI Africa PI, programs that only involve a single institution, programs that only offer didactic learning experiences, proposed activities that already have funding from the DSI Africa program or other sources, proposed activities that are not completed within a 12-month period, proposed activities that are not offered each year of the Ue5, and proposed programs that lack one or more of the required components in the research education program plan. So these types of applications would not be considered responsive, and would not move forward to peer review. Moving on to the Ue5 eligibility. So applicant organizations must be African organizations that are either African public state-controlled institutions of higher education, African private institutes of higher education, or African nonprofits other than institutes of higher education. Partners in applications can come from any type of organization. So the partnerships can be with organizations in Africa, the US, or other countries, including for-profit and government entities. And for this particular opportunity, non-domestic, or what we would say non-US components of US organizations are not eligible to apply. Some key dates to consider when putting together an application. The letter of intent, while optional, is requested by August 29th. This does help program and review staff start preparing for the future peer review of applications. So we do appreciate receiving these letters of intent. The applications themselves are due September 28th by 5 p.m. the local time of the applicant organization. The applications will be reviewed in next March and go to advisory council in May, and then be funded shortly after. The Ue5 is a relatively rarely used activity code at NIH. These are for research education projects that use a cooperative agreement rather than a grant mechanism. And so the easiest comparison is the R25. Some applicants may be more familiar with that activity code. So the Ue5 is the cooperative agreement version of an R25 and has all of the same kind of components that an R25 would have. You can also look at the terms and conditions in the funding opportunity announcement to see what specific terms are established for these cooperative agreements. For this particular announcement, clinical trials are not allowed, and the budget may not exceed $200,000 US dollars per year, which includes both direct costs and the 8% indirect rate. Projects may be funded up to 3 years, and we expect to fund up to 5 meritorious applications through this particular announcement. Just wanted to point out a couple of unique application instructions for the Ue5. The first is being that the research strategy section for research education programs is where you would upload the research education program plan. So a little bit different components than you might see for a research project. This plan includes proposed research education program, the PDPI, the program faculty, the program participants, the institutional environment and commitment, the plan for instruction and the responsible conduct of research, the evaluation plan, and the dissemination plan. And then moving on to the review of these applications, similar to other NIH applications, the applications will move forward to NIH peer review and will be assessed based on 5 scored review criteria, including significance, investigators, innovation, approach, and environment. Each of these criteria have sub-questions that are used by reviewers to assess the merit of the applications, and the funding opportunities list these questions if you'd like to look at the specific considerations that the reviewers will be making for these applications. These criteria are then used to inform the overall impact score of the applications, and this impact score reflects the assessment of the likelihood for projects to strongly advance research education by fulfilling the goal of the Ue5 education program. In considering the funding of applications, NIH strongly uses this NIH scientific peer review in assessing the applications, and also considers the availability of funds, the relevance of proposed projects to program priorities, the relevance of proposed projects to the goals of DSI Africa, the relevance of the proposed project to the priorities of co-funding, so other institutes or centers, the commitment to compliance with DSI Africa procedures, and the consideration of programmatic, geographic, and institutional distribution. And with the NIH peer review, it's important to note that each application will receive a written critique. So the applicants do receive the feedback from their application regardless of what the overall impact score is. So finally, for this funding opportunity announcement, I'll leave you with some contact information for myself, and also for the scientific review officer for this announcement, for the grants management contact for any kind of policy or budget related questions. And in addition, some application submission contact information if you need help as you're trying to put together and submit the application. So I will turn it over now to my colleague, Brad Newsom, to talk about the Partnership for Innovation research project.
Good morning, good afternoon, everyone. Wonderful to have so many people joining us today to learn about both of the UE5 training awards as well as these Partnership for Innovation research projects, which utilize a U01 clinical trial not allowed activity code. And you can find it under RFA-RM-22-023, as well as on our website. This program is meant to advance data science and related innovations in Africa through creation of a multi-sectoral and multidisciplinary ecosystem that can begin to provide local solutions to countries' most immediate biomedical and public health problems through advances in research. And this also supports discrete research projects led by African investigators to expand the DSI Africa Consortium. While this is similar in some respects to our currently funded U54 research hubs, this is more meant to be discrete projects as opposed to multi-project, multi-core centers that are currently funded. And these projects will be used to enhance the career pipeline and retention of health data scientists in Africa by supporting a minimum number of new and early stage investigators. While established investigators are welcome to apply, we are prioritizing a minimum number of new and early stage investigators to bolster that career pipeline. This is also meant to support innovative health data science research and solutions in Africa with the ability to advance population relevant, affordable, acceptable, and scalable data science solutions, and hopefully in the long term, demonstrate the ability of these solutions to improve health in Africa. The U01 involves key research opportunities that are cross-cutting in nature and interdisciplinary, pulling together biomedical scientists, computer scientists, engineering subspecialties, social and behavioral science, and other fields that are all working together to address complex problems from their component parts. It also focuses on critical health research areas to be addressed through data science, contextually based in Africa. This involves cross-cutting research, disease-specific research, or data-specific research. All of these areas can be proposed. You must propose methods to form, maintain, and or strengthen governmental, academic, and private partnerships to drive sustainable, collaborative data science linked to new technologies. You also have the opportunity to utilize different data types and sources, such as clinical, public health, genomic, imaging, geospatial, mobile and environmental data, and more. These are just examples. Overall, the goal is to leverage existing data sets in Africa, existing technology and infrastructure whenever feasible. That is not always feasible, but whenever it is, we want to capitalize on what is already available on the continent. Some key research examples. Again, this is a very short list that you can find much more expanded within the funding opportunity announcement. But generally, this involves multi-omics computational research, development and use of shared platforms and leveraging of large health data sets that enable discovery of emerging multi-morbid patterns. Another example is development and leveraging of novel machine learning and artificial intelligence or computer vision tools for data analytics, computer-assisted detection, and diagnosis or treatment. Another example being the development or expansion of informatic tools and statistical methodologies to analyze multidimensional environmental exposure data. And another example being utilization of data science technologies and approaches for behavioral health interventions. Overall, applicants are encouraged to consider the unique opportunities for African research contextualized appropriately, which include extensive genomic diversity, migration and admixture, diseases and health conditions prevalent on the African continent, environmental exposures and health-related conditions, and local health priorities defined both very locally at the health system level and at the governmental level within your region. For more information on the specific examples that the NIH partnering institutes, centers, and offices are prioritizing for their partnership in this, you can see the FOA that has many broad research examples, as well as a link to much more extensive institute-specific information. If you are interested in a specific area that aligns with one of our institute, centers, and offices, you can go to this link and find more information about the specifics of those institutes that are really prioritizing certain areas within the data science regime. Very importantly, some of the eligibility requirements, you must be an African organization to apply. That does not mean that you can't have very diverse partnerships, but it can be African public or state-controlled institutions of higher education, African private institutions of higher education, or African nonprofits other than institutions of higher education. You must have proposed partnerships with organizations outside the applicant institution, and you must include all types of organizations in Africa, the US, or other countries, including for-profit and government entities. One of the important elements of this program is to expand on the current DSI Africa consortium. So at least one of your partner organizations should be involved that is new to the DSI Africa consortium. While we have broad applicability of different kinds of organizations, government, for-profit, nonprofit, academic, one of the organizations within your application must be new to the DSI Africa consortium. And importantly, non-domestic or non-US components of US organizations are not eligible to apply. This program utilizes a UO1 research project award mechanism, which is a cooperative agreement mechanism that Laura described earlier. And you can find more information around the terms and conditions associated with this cooperative agreement within the funding opportunity. Up to 12 meritorious applications will be funded. And again, half of the funded projects should be awarded to early stage investigators. So while we are not discouraging established investigators to apply, please note that we are utilizing this also as a capacity building opportunity by supporting a minimum number of early stage investigators. These projects will be funded for up to 3 years, and budgets must not exceed total costs, direct and indirect costs, of $250,000 per year for each of the 3 years. More than one application may be submitted by an institution as long as each application is scientifically distinct. It's important to know that this is a clinical trial not allowed. We are utilizing a clinical trial not allowed mechanism based on multiple factors, especially considering the size of the awards and the time. But it's important to know what we consider to be a clinical trial. And the NIH definition of a clinical trial, you can see here, and there's much more information within the funding opportunity announcement, but there is a checklist within the funding opportunity that you can link out to make sure that what you're proposing is not considered a clinical trial. And for determining this, we use 4 questions to determine if your proposal is a clinical trial involving, does the study involve human participants? Are the participants prospectively assigned to an intervention? Is the study designed to evaluate the effect of the intervention on the participants? And is the effect being evaluated a health-related biomedical or behavioral outcome? If you answer yes to all 4 of these questions, NIH determines this application to be a clinical trial. And in that case, it would not be responsive to this UL1 clinical trial not allowed mechanism. This is very important. So we do not want you putting in applications that then will be deemed non-responsive. So make sure that you check this out and make sure that what you are proposing is not considered a clinical trial. Again, I want to emphasize the importance that we're placing on supporting early stage investigators. And how we define an early stage investigator is a program director or principal investigator who has completed their terminal research degree or end of their postgraduate clinical training, whichever date is later, within the past 10 years, and who have not previously competed successfully as a PDPI for a substantial NIH independent research award. And how we define a substantial independent award is considered an R01 equivalent grant mechanism, including a UO1. This mechanism, as a UO1, is an R01 equivalent. There is further information on the NIH website about what is considered an R01 equivalent grant activity code, and more information generally on ESI status. While this is not a requirement for receiving a UO1, we are prioritizing this, and we want to encourage early stage investigators to be applying for these really unique awards. Again, the UO1 key dates are similar to the UE5s. We are requesting a letter of intent by August 29th, with an application due date of September 28th, 2022 by 5 p.m. of the local applicant organization. We also, unlike the UE5s, we accept AIDS-related receipts of application, and these have a separate receipt date. So the AIDS applications are due December 6th, 2022 at 5 p.m. of the local or applicant organization. This is important if you are proposing work that involves HIV/AIDS. You can utilize this later application window, but anything else that does not involve HIV/AIDS must be received by September 28th. We will then, along with the UE5s, review these for scientific merit in March of 23, go to an advisory council review May 23 for a start date soon after. This review process, not to be confused with the similarities with the research hubs that were funded previously. This only involves a discrete research project, so these will follow the normal NIH review criteria that Laura discussed earlier. We'll look at overall impact. We'll look at the scored review criteria of significance, investigator strength, and innovation, approach, and environment. We'll utilize our normal 9-point rating scale, and we'll also include additional review considerations around protection of human subjects, inclusion of women, minorities, and children, resource sharing plans, that's especially important for data science related work, and budgets and periods of support. These are very standard review criteria. But it's important to remember the differences between this and the research hubs, as well as the differences within the UE5s. Our selection process, again, we are prioritizing some level of early stage investigators and how it builds out the current DSI Africa consortium. But as a part of the scientific peer review, all applications will undergo a selection process in which only those applications deemed to have the highest scientific and technical merit will be discussed and assigned an overall impact score. Everyone will receive a written critique regardless of the impact score that you receive. And additional considerations that we'll use for making funding decisions involve scientific and technical merit of the proposed project as determined by scientific peer review, the availability of funds, your early stage investigator status, the relevance of the proposed project to program priorities, relevance of the proposed project to the goals of DSI Africa, relevance of proposed project to the priorities of co-funding components of NIH institutes, centers, and offices, commitment to compliance with DSI Africa procedures, and consideration of programmatic, geographic, and institutional distribution. My contact information is here, along with my colleagues within scientific peer review, as well as our finance and grant management contacts, including additional help for application submission through ERA Commons Help Desk, grants.gov customer support, and our grants info telephone and email addresses. All of this information will be available to you, but please be aware that we are here to help to make sure that your application is not only responsive to the funding opportunities and appropriately designed to be responsive, but also to make sure that you can work through the difficulties associated with applying to an NIH award. With that, I will turn it back to Laura. Thanks, Laura.
Yeah, thank you, Brad, and thank you all for listening. I hope this has been informative. I see there's a number of questions already in the Q&A box, which is great. We'll start off with a couple questions that were submitted kind of before the webinar, and then move on to the live questions. So just to get us started, we received questions from new NIH applicants who've never applied to NIH before, just asking, where should I start? And to answer that, I would recommend starting by looking at the website that I mentioned previously about how to apply to NIH. And I'll put that in the chat box so people can check it out right now. But it goes over what's required in terms of registrations, which are really important to consider early on, along with the steps necessary to take to apply, and links out to specific instructions for different kinds of applications. So that's a great resource to start with. Second question is, I'm not currently funded through DSI Africa. Can I apply to these opportunities? And definitely yes. These opportunities are open to all African organizations, not only those supported currently by DSI Africa. There are obviously specific requirements within each funding opportunity, but broadly for the eligibility, any African organization that is a institute of higher education or a nonprofit are eligible to apply. For the third question, I'll point to Brad for this one. Are non-academic private for-profit companies eligible to apply?
Yes. So we walked through the eligibility requirements associated with this program. While nonprofits, institutions that are for-profit, they are all eligible to apply or be partners. But remember, there are multiple registrations that are required through assam.gov for your institution, as well as through ERA for each of the applicants that are putting forward an application. Also remember that the applicant organization must be African-based. While the partners can be anywhere in the world, it must be African-based. So you have the opportunities to apply even if you're not an academic institution, but often it's important to make sure that your partnerships are appropriate to be able to not only put in a successful application, but also understand the complexities of the NIH grant system. And sometimes having an academic partner that works more with NIH grants is helpful to you. It is not required, but make sure that you have a team that has all of the skills associated not only with putting together a meritorious application, but also understands the NIH grant system.
Another question for you, Brad. Are the U01 Partnership for Innovation research projects restricted to any specific disease or health areas?
Great question. And no, they are not. This is just like the other funded programs, is supported through the NIH Common Fund. And the Common Fund is trans NIH in nature. So any disease areas are applicable to this program. Now, we do have, like I alluded to earlier, we do have more information around the disease-specific or the institute-specific priorities that you may want to look to just for further guidance. While you can apply to with any disease-specific area that would typically be housed within the 27 institutes and centers that make up NIH, they are not required to be a specific disease, but it can be guiding to look at that information for the specific areas of priority associated with the individual institutes.
Great, thank you, Brad. And the final question that I'll read off that we received ahead of time is that the Ue5 Research Education Program requires a letter of support from a current DSI Africa PI. How can I learn more about the current awardees and connect with them? So I mentioned previously that we do list all of the awardees on the NIH Common Fund website, and that includes information about the awards and also the email addresses for the contact PIs. So that's certainly a way to learn more about the awardees and reach out to them. The Coordinating Center's website also has information about the consortium, including an email address to reach out to the Coordinating Center itself. So I would recommend starting with those areas. We also, like I mentioned, will advertise any other networking opportunities that we're able to develop within the next month or so, and make sure that all of you are aware of those opportunities as well. So Greg, I will hand it over to you to read off some of the other questions that have come in.
Sure, thank you, Laura. There are a number of questions submitted that we'll go through now. Hopefully we can get through as many as possible for 10. Some of these questions are similar to topics that we've already discussed during today's session, but due to the nature of the way they were asked, I'll read them anyway in case there are any nuances. As a reminder, this full meeting will be posted, this full recording will be posted in the coming week or so online, so any further context can be gotten there. But our first question is a two-parter. So part one is, could you please provide guidance on how to identify needs and gaps within the DSI African Consortium? And part two, could you please talk more about having multiple PI/PD, including some from US institutions?
Thank you, Greg. So for the first question, in terms of identifying needs and gaps, I think first learning about the consortium and the group of awardees is a great place to start, and checking out the Common Fund website with the list of awardees. You can also, like I mentioned, connect with the awardees to begin understanding from the PI's perspective what they think the gaps are. In addition, the DSI Africa Coordinating Center does facilitate a training working group for the consortium, which has started to look at what is the training activities happening within the consortium and potential kind of needs and gaps. And so certainly reaching out to the Coordinating Center through their website, I think is also a great place to start. The second question was about the multiple PI setup. And it certainly is a leadership organization, or a type of leadership for an application that is encouraged for these kinds of applications, both for the Ue5 and the U01. A multiple PI application is allowed. That can include PIs from the applicant organization and PIs from other organizations, from partner organizations. So that could include a PI from a US organization that wants to partner with the African applicant organization. There just needs to be justification within the application itself of why the multiple PI model is needed and what the specific roles of each PI will be in the application. Brad, is there anything you would add to that?
No, not that covers it.
Okay.
All right, next question. We are anticipating doing a health system intervention, which includes using technology and data methods to improve health system functions. It will involve working with patients and caregivers, but they are joining together to improve health outcomes, such as treatment uptake. Is this a clinical trial?
Yeah, that's an important question, like I alluded to earlier. And you can utilize those four questions to determine when we're working at health system levels. Often, we don't have prospective assignment to different groups. So often, it is not considered a clinical trial because you're not actually intervening. You're looking at data at the health system level without specifically looking at defining different groups. So when that is the case, it is not considered a clinical trial. It's considered clinical research, and that is allowed. Clinical research is still certainly allowed, even if a clinical trial is not. So it's going to be really important to look at how you're framing that. I'm looking a little bit at the question again, using technology and data methods to improve health systems functions. That does not sound like you're assigning to groups, which would then make it a clinical research and not a clinical trial. But look at those questions and reach out to me, and we can walk through this with a little bit more detail than we can look at right now.
All right. Can any country in Africa apply, such as Egypt?
Yeah, so the opportunities are open to African organizations across the continent, not only specific regions. So certainly Northern African countries are eligible to apply.
All right, are staff from private companies eligible for grants and awards?
When you say our staff from private companies, yes, that is certainly allowed. Now, of course, there are many different ways to structure an award or a sub-award to perhaps a private company. Depending on how you're structuring it, staff from private companies are absolutely allowed to be funded through an award. But we would want to talk through a little bit more in depth about who's going to be a prime applicant institution versus who's going to be sub-awarded.
Yeah, and just to clarify too, because I think this question may come up again, that the applicant organization should be an African nonprofit or African Institute of Higher Education, but private companies can partner and be supported through a sub-award. Just so that's clear for everyone. Yeah.
All right. Are non-domestic / non-US components of US orgs eligible to be subs to other organizations who are applying, i.e. members of a consortium?
Yes. While a non-domestic, non-US component of a US organization cannot be the prime applicant organization, you can be a sub-award.
Yeah.
All right. In order to apply for the Ue5 from a certain country, is it a must to get a support letter of previous DSI Africa awardee from the same country?
Thank you, Greg. Great question. So the current DSI Africa awardee that writes the letter of support can be from any of the current consortium awardees. It doesn't have to be necessarily from the same country as the new Ue5 applicant. I think it's just a matter of finding the right fit and partnership to provide that letter of support.
All right. In the RFA RM 22-022, what do you consider as community engagement?
Yeah, so we discussed community engagement a bit in both funding opportunities. For the research education program, in terms of skill development, we specifically discussed skills that would be needed by researchers to perform community engagement. That could be related to empowering communities to become actual partners in the data science research that's being conducted, or to engage with other stakeholders that are directly involved in or impacted by the research being conducted within the consortium. So it is relatively broad, and certainly would be happy to discuss specific ideas.
All right, thank you. Can you clarify the point that activities exceeding 12 months will not be considered, as this is a multi-year grant?
Yeah, so what that is referring to is the specific courses that are proposed should not be, the course themselves should not extend for more than 12 months at a time. So essentially the courses that would be funded through the UE5 are considered more short-term training. And so, for example, the UE5 would not be used to support degree-based training, which you would imagine would last for multiple years, where a single trainee would be supported through, say, a master's or a PhD for multiple years. That is not the intent of the UE5. The courses that will be supported must last shorter than 12 months and be repeated each year. So for a 3-year award, you would expect the courses to be delivered each year, but each course would last fewer than 12 months. I hope that helps.
All right, please highlight a little bit more on the hubs. What are the hubs, the locations, and the focus?
So this is important, and Laura spoke earlier about the currently funded awards. We have 7 research hubs that are multi-project, multi-center, or multi-core centers that involve a breadth of current research. And that is highlighted both on the NIH Common Fund website as well as the dsiafrica.org website. And you can find out more information about all of the different research hubs that are currently funded, and there are 7 of those. There are 7 training programs. There are 4 programs that deal with ethical, legal, and social implications, and 1 open data science platform and coordinating center that are already funded through this. But speaking specifically to the research hubs, these are very large awards that involve a lot of different components. And while they are doing specific projects within those hubs, the difference is not necessarily, the difference between the hubs and the UO1 research projects are not necessarily dramatic differences in the kind of research that can be proposed, but the scale is different, the funding is different, and you're only allowed 1 research project within an application, whereas the hubs required at least 2 research applications and the ability to launch pilot projects. So it's a really scaled down approach, but you can find much more information about all of the different hubs, where they are located, the diseases that they deal with, the data sets that they deal with, and general information about each one of those associated with their contact information and their abstracts on the DSI website, as well as the recently launched dsiafrica.org website.
All right, can PIs of existing DSI awards apply under this call?
Yes. So like I mentioned, the opportunities are open to African organizations across the continent that are nonprofit or institutes of higher education. There is a kind of unique requirement in the UO1, and I'll have Brad explain that.
Yes, so while the current applicant or currently funded awardees are certainly eligible to apply, it is a requirement for each of the research projects, the UO1 awards, that you bring in at least 1 new partner that is not affiliated currently with the DSI Africa Consortium. That can be a brand new applicant to the program as an applicant organization, or an applicant that currently has a funded award through the hubs, the training projects, the LC awards, and then you bring in an additional partner that is not currently associated either as a multi-PI or as a various sub-award partner. So that is a requirement because we want to continue expanding the reach of this program across the continent over time. So it is important that you need to bring in at least one new African partner.
All right. Last year, we applied for R01 and application was not funded. Can we modify the same application for Ue1?
Well, yes, you can. The important things here, so I'm not sure what kind of R01 it was that you applied for, but remember that this award is capped at $250,000 per year, total cost, not direct costs, total cost, which involve direct and your indirect costs, and it only lasts for 3 years. So making sure that you scope it down, both based on the amount of money as well as the amount of time. So while a Ue1 is an R01 equivalent award, you're going to need to scope it down in order to reasonably fit within the time and the money constraints of this award versus an R01 that has 5 years of funding at $500,000 direct cost. You're going to have to bring it down, but you can repurpose an unfunded R01 or a project. Say you applied to a U54 research hub before, you have the ability to take one of those projects that you had originally written if it wasn't funded and repurpose that application as well. Again, it doesn't involve cores, it only involves one research project, but you can utilize that as well.
All right, thank you. Regarding clinical trials, would working with human subjects for the purpose of building data sets be considered human trials? For example, collecting X-ray images with and without TB present in order to train and evaluate a machine learning model be considered a clinical trial?
Yeah, and this is another area that we'll want to have a specific conversation about. We'll walk through those questions, but as we discussed earlier, when collecting information for the purpose of training a data set, a lot of times that is not considered a clinical trial because you're not intervening differently on two different groups. In this case, just collecting X-ray images with and without TB, you're not intervening on that group. You're collecting data. You are, while we encourage the utilization of currently accessible data sets, you are allowed to collect new data. If you were intervening differently on these groups, it would be considered a clinical trial. But if you're just collecting the data for the purpose of training a machine learning system, typically not considered a clinical trial, but it will be important to follow up. And we'll go through these questions and make sure.
All right. Does the PD/PI for the RFA RM 22022 have to meet the criteria for early career researcher?
So RFA RM 22-022 is the research education program. And for that particular program, there is no kind of distinguishing factor between early career or established investigators. So all level of researchers are eligible to apply. Just to clarify, for the Ue1 for RFA RM 22-023, there will be a special consideration for supporting early career investigators, but all investigators are eligible to apply. We just wanted to make it clear that we are planning to support a certain number of early career investigators.
All right, in the budget section of the RFA for the REP, it states that travel for key persons is allowed. Can I confirm that key persons includes all of the participants and faculty of the training activity?
Yeah, so the key personnel are specifically named in an application, and that is decided by the applicant to determine who are the key personnel that will be providing the primary leadership of the program. In terms of travel for kind of participants or other types of travel, I think that's more consideration of the budget that's available for the program and what's feasible. But this may be a question that would be better to kind of discuss through an email or a phone conversation to work out the details.
All right, and for our final question, as we're running up on our time here, are there any restrictions on how much budget can go to different organizations, e.g. African versus US organizations?
Yeah, so there are no specific requirements or restrictions on the amount of budget, but certainly we do want to keep in mind that this program is intended to support African leadership and to support research and research education in Africa. So I think you wouldn't want to dedicate your entire budget to go to a different, to go elsewhere. But I think it's up to the applicant to decide what's appropriate for their specific application and to justify that in their budget justification.
I would add to that remember this for the training award, it's capped at $200,000 per year total cost and $250,000 per year total cost for the research awards. Remember, when you're calculating indirect rates, when with the U.S. organizations have negotiated indirect rates that are very high often, and it will very quickly eat in to that total cost cap. So the more money going to the U.S. institution, quite a bit of that will go to indirect rates. So be very mindful. It can very quickly diminish your ability to do the research that you're proposing when substantial amounts of funding are going to the U.S.
All right, thank you all. That we are now right at 10 a.m., so I will pass it back to Laura and Brad for some closing remarks.
Yeah, thank you, Greg. We recognize there are a number of questions that we weren't able to get to in this webinar, and certainly we'll take a look at those and post some frequently asked questions on the website to try to address any remaining questions along with those that we've answered today. But also please feel free to reach out to myself or to Brad if you want to discuss specific potential applications or have other questions that you need us to answer. We're certainly happy to do so. And again, thank you all for joining us today. And we look forward to interacting with you further. Take care.